Hi everybody, I'm Dr. David Alfonso, board certified plastic surgeon. Really excited to have a webinar to share with you regarding blepharoplasty or eyelid surgery. I'm joined with Brooke today, who you're going to learn a little bit more about. I would encourage all of you to stick around for the Q&A session after the webinar ends.
My name is Brooke Cummings, and I'm here to talk about my eyelid surgery that I had 5 weeks ago to this day with Dr. Alfonso. And I actually met him about just over 3 years ago. I had a breast reduction with him, and that is kind of what led me back to come and get another procedure. And I've been happy so far, and my healing is almost over. So we're going to talk about that, and I'm excited about it.
A blepharoplasty surgery is just a fancy term for basically reshaping the eyelids. And this is very popular surgery for patients. Oftentimes we will treat the upper eyelids or the lower eyelids or both together at the same time in surgery. Really the goals of the surgery are to make the patients feel more comfortable and improve self-esteem about how their eyelids look, get rid of some of the excess skin as well as some of the puffiness from the fat that's above and below the eyelid to create an overall more natural but youthful looking eyelid area.
So I think for me, choosing the Bengtson Center again and Dr. Alfonso was super easy. Much like they asked me to come and do this webinar, aligning myself with this center and Dr. Alfonso is an ultimate, like, just easy yes, because the way everyone is here, the professionalism, the nurses are so kind. It is just kind of next level here. Anytime I get a private message about this specific center, I'm like, I can't find anything bad about it. Trust me, I've tried to be like, they should have done this, but like I'm still kind of looking, but I can't find anything.
We hope to continue to disappoint you.
Yeah, but anyways, just this center in general, like I could not recommend just how they make you feel from the minute you walk in the door, and then just the comfortability. I really felt like Dr. Alfonso like truly cared, which, you know, you hear that from so many people. And the nurses are so kind. It is just kind of next level here. Anytime I get a private message about this specific center, I'm like, I can't find anything bad about it. Trust me, I've tried to be like, they should have done this, but like I'm still kind of looking, but I can't find anything.
We hope to continue to disappoint you.
Yeah, but anyways, just this center in general, like I could not recommend just how they make you feel from the minute you walk in the door, and then just the comfortability. I really felt like Dr. Alfonso like truly cared, which, you know, you hear that from so many people anywhere, like, oh, like I just like I felt like a number, and it's just, I really felt like he got to know me here and like actually cared about my results. And if I did have something wrong, he would be like, okay, like tell me what it is. I felt like he would more than willing listen if there was something.
Yeah, I think, you know, the key thing is to make patients feel as comfortable as possible about their decision to have cosmetic surgery. We try and make it very unhospital-like here, as you can attest to. You know, when you come in, it's a much more kind of luxurious, warm, welcoming environment, very private. And our staff, from the moment patients hit the door to the time that they're going back to the OR, every touch point along the way, you know, we take pride in having staff members who are super friendly. I think patients will say that they feel really at ease by the time it's actually surgery day and they're on their way into the operating room to have a procedure done, because we understand it can be a little bit stressful. And I think that we really take that to heart, and we want to make everyone's experience here as good as it can be. And so I'm glad to hear that that was your experience, because that's what we strive for every single patient who, you know, walks through our doors.
Yeah, for sure. It's hard to find a place that you could actually say is like 100 out of 100. And I just feel like I would always come back to Dr. Alfonso, because I feel like he really does like care about whatever I would need done. Hopefully it's not anything for a couple of years, but like I feel like whenever I'm ready, or if I send a friend, I know he has and will take very good care of the people that I send. Yeah, I would probably say just reading in general about this specific procedure helped kind of prep me and know that, like, okay, probably not going to be able to wear eye makeup for 4 to 6 weeks, or probably going to have a little bruising, like just to kind of understand what like the aftercare is going to look like. For me, I was so excited to get it done that, and a lot of times with everyone, they're so excited to get it done, they just kind of fast forward through that and they're like, oh no, I have bruises. But it's important to just kind of do a little research into like what the aftercare will be, just so you are prepared.
So during a blepharoplasty surgery, patients are typically under at least some sedation. They can be done under local, or patients are wide awake and numbed up. But for the most part, patients choose either sedation anesthesia or sometimes even more involved anesthesia if I'm doing more work on the lower area. But patients are typically unaware of what's going on. They don't feel any pain during the surgery because, again, as a surgeon, I inject the local anesthetic. It numbs the tissue. And before patients know it, they're in the recovery room, kind of waking up, a little sleepy, but they're feeling really good. And the overall recovery from the surgery is really pretty mild. You know, most patients feel like they have mild to moderate pain and don't need to take pain pills really beyond 2 to 3 days. You know, so typical recovery after a blepharoplasty, pain level really is gone pretty quickly. Patients are very comfortable, but there is definitely bruising and swelling, as you probably can attest to. Patients are allowed to put a little bit of cover-up makeup on. Usually that's in about 10 days at a minimum, sometimes in the lower eyelid area. Usually it's a few weeks longer than that before a patient would put on like eyeliner and mascara, just ensuring that the incision is healing well and not having any issues for that. But usually the swelling persists for a good few weeks. But I've had patients who looked very, very good and were comfortable being out in public as early as about 8 to 10 days out from the procedure. People vary in terms of their swelling. We also go over a lot of tricks, things that we recommend to patients to do before surgery and then after to minimize that recovery time.
So almost 4 years ago, I had a breast reduction here, and I would say the recovery for my eyelids was much different. It was not nearly as long, and it didn't hurt at all. I think that's the biggest question that I got on my blog when I posted about it, was if it hurt and if I was awake, and it was so much easier than my breast reduction. But, you know, it was, and Dr. Alfonso told me this, it was going to be probably one of the easier procedures that he does here in terms of recovery. So I kind of expected that, thankfully.
So right after surgery, patients generally look a little bruised and a little swollen. That's always pretty much par for the course. However, if you look past that, you can see a difference even right away in terms of the visibility of the eyelid and seeing that some of that skin is definitely gone. As patients get out more along the lines of 10 days, 12, and then weeks out, they start to lose the swelling and the bruising, typically by about 10 to 12 days. So the results are really visible pretty early with this surgery, which makes it such a popular surgery, both because it's a minimal recovery pain-wise, but it's also starting to see things. Unlike other surgeries we do where there's a lot of swelling, it takes months, this is more along the lines of starting to see almost final results in a matter of weeks rather than months.
Yeah, for me, I still had like a tiny bit of bruising at 2 weeks. And then after that, it went away, and it's just like a little bit of where the incision was. But I just wore my glasses. That was one thing that Dr. Alfonso had told me, like, wear your glasses, or if you have readers, and like, since it's right in the crease, like no one can really see it anyways. Even to this day, being 5 weeks on this side, I can just see a little bit there. This side is almost healed. I didn't even really, have you look at my eyes when I got here, but, overall, like, feeling good for me, and I just have probably just a little bit left of healing, and then I should be like not even noticeable, except for like that I look more awake And my friends had told me that a couple of them had it done. They just said the biggest thing is you're going to feel like you're like you look more awake. People might be like, oh wow, you look refreshed, but they can't like maybe sometimes figure out what it is. So I'm excited. I feel like I'm already to that point, but it's only going to get better probably this last few weeks of healing. My personal recovery with the eyelids were mainly just, I stayed home for that first week, but I had planned that. So definitely you'll want to obviously make sure you're not scheduled at work and you have maybe someone around to check on you and just drive you home. For me, my husband drove me home just because you don't want to be driving after you just had like something done to your eyes. So just like little things like that. And then I would say in terms of like anything that was surprising to me, I would say that just that we finished, well, number one, that I didn't have to go under to have it done. I just took like some medicine and then went into the operating room, and we were in there for about an hour, and the music was playing and the nurses were friendly and we were talking. I was awake. And then really it was just like right after it was like, all right, you can put on your stuff as long as you're feeling good and you can go. So I think that was the most surprising part for me.
Yeah, in terms of, I think, educating patients, it's all about expectations. I really want patients to go into their surgeries really knowing what to expect based upon our conversations. I try and spend a lot of time, as you can attest to, talking about the pros and the cons, what to expect. And I think an educated patient who has realistic expectations about what am I going to look like, 2 days out, 2 weeks out, and then 2 months out, is going to have a great result and going to have a good experience because they're really going to be knowing what they're getting themselves into. I do think that patients sometimes don't take advantage of necessarily doing upper eyelids and lower eyelids together, and then they say, oh wow, my lowers kind of look puffy now versus my uppers. And also I think it's important to emphasize really the pretty rapid recovery with this. And I think patients sometimes think they're going to look bruised for 6 weeks and have to be like a hermit, not leaving the house. And, as Brooke can attest to, it's really not the case. I mean, it's some downtime, just like any surgery, but I think most patients are really pleasantly surprised that have it and go through it and say, wow, it's 8 days out, stitches are out, I'm feeling good. I can be out and doing some basic things out, in public.
Yeah, I think after we had the stitches out at 7 days, I just wore my glasses because I couldn't wear my contacts for like another week, or I can't remember what you told me, but
2 weeks,
yeah. So, but after that, like I was like going to Target with my daughter, and like there was still a little bruising after that first week, like I said earlier, but it was very minimal and not noticeable behind your glasses. So it was like the least of my worries, really. I mean, I didn't really have any worries because I just wanted it done so bad. But like, I think a lot of my readers, when I shared it on my blog, many of them were like, well, how long? Like, I got to go back to work. And so, I mean, it's not the same for everyone. I can just share like what it was for me. And definitely nice to have like a week home and just kind of hibernate and get rid of most of the bruising. And then after that, like if you just wear glasses, you're good to go. Someone on my blog had sent me a private message asking like what was something that like I wish was different, or like what do you regret about it and stuff like that. And I literally was like, the only thing I regret was that I maybe didn't consider doing my lowers at the same time, just because I'm already kind of in recovery and at home for a week, so why not do both? But I'm 46, so I'm like, and I don't necessarily need it that bad right now, I feel. So I kind of want to wait and see. I want to be very careful about like the procedures I do. And also I have a daughter and she sees all this. So I'm very, very careful about what I'm doing because I know she is 100% watching me and everything I'm doing. So, and that means something to me. So, we'll get there maybe if we need
Always
the
next
lowers.
time.
Yeah, exactly.
Yep. Well, hopefully that was informative for everybody. We'd like to thank you for attending and kind of viewing the webinar, and we'd like you to stick around, and we're going to go into the Q&A session where a lot of important questions will be asked and answered. Take care. Hi, everybody. Hopefully you found that informative and enjoyable. It was great getting collaborating with Brooke and kind of going through her journey. And we're really excited to be able to offer you some time for some questions and answers, either for myself or for Brooke regarding anything that you may have heard about during the webinar and would like to have some more information on. So we already have some questions popping up. So I'll start and kind of go into that. And then we encourage you to please submit those if you do have questions. So one of the first questions that came up was, how do you know if you're a candidate for upper blepharoplasty versus a brow lift or vice versa? And that's a really good question, because sometimes patients come in and they have a lot of concerns with the upper part of their eyelid, and the brow is contributing to some of the heaviness and fullness. And oftentimes I will recommend doing both, where we can do a brow lift as well as an upper lid blepharoplasty. And it's very patient specific and unique. It really comes down to the patient's anatomy and whether or not a brow lift is going to help get a better result, or do we do just a brow lift, or do we just do an upper lid blepharoplasty, and as I mentioned, also a combination. So it's obviously very unique to the patient based upon anatomy. That's what the benefit of the consult is. When you come into the office and we're able to evaluate you here, we'll talk about what procedure would be ideal, to achieve your cosmetic goals. All right, a couple other ones have just popped up. What can I do before and after surgery to help reduce swelling and bruising? Well, that's a very good one, because everybody wants to look really good really fast, right? With a minimal downtime. So the good news is we do a lot of things in surgery, but pre-surgery, there are some things that patients can do. We have them avoid aspirin and aspirin-like products ahead of time, meaning that if you have a headache or ache or pain, we encourage the use of like Tylenol. Because those other products can affect your platelets and your bruising and potential for bleeding. That will help with minimizing bruising. Also, eating really clean, avoiding a lot of salty foods pre-surgery as well as post-surgery. Foods that are very high in sodium tend to make patients a little bit puffy and swollen. And after you've had an eyelid surgery, that can exacerbate or make the swelling worse. So those are a couple factors. Fresh pineapple before and after surgery has a compound in it that really helps with minimizing bruising as well. So all these things are discussed with patients ahead of time. And between pre-op planning, intraoperative techniques, and post-operative following the instructions, it's really going to give you the best potential outcome, and try and keep that window of bruising and swelling down to as short as we can. All right, another question. How long does the surgery usually take? It's variable, and it depends on what we're doing. For the upper eyelids are easily done in about 30 to 45 minutes if we're doing those just by themselves. If I'm doing a more involved procedure like brows, upper eyelids, as well as lower eyelids, sometimes that procedure can go up to 2 to 2.5 hours. Rarely are eyelid surgeries beyond about 2 to 2.5 hours at the most. And depending on what procedure is done, sometimes, as mentioned, they can be done with patients either wide awake under local, or some sedation, or completely asleep. It depends on a few factors. Number one is patient's desires, but also the amount of work I need to do and how deep we need you to be sedated. So in many cases, patients will opt for just being completely asleep because they just want to go to sleep, wake up, and be done with surgery, which can be, nice for them. So time-wise can vary, but usually somewhere between 40 minutes to 2 hours, depending on how much is going to be done in one time. All right. What exactly does the lower procedure entail? So there's a couple ways to approach the lower eyelids, but most patients who come in kind of share the same concerns, is that they have extra potentially loose, crepey, or wrinkly skin of their lower eyelids, oftentimes combined with what patients usually call eyelid bags, which is excess fat. And the procedure involves removing some of that excess fat, sometimes repositioning some of it to smooth out the crease, and then getting rid of extra skin, as well as oftentimes tightening the muscle layer. So it's really obviously dependent on your age, how involved the fat is, how much fat is there, how loose is the skin. Typically, the incision goes right underneath the eyelash line and then out to the side. It heals really well. In younger patients or in patients who don't need much skin work done at all, sometimes I'll do a technique that I go in through the inside of the eyelid while you're asleep and there's no scar on the outside. That works well for younger patients who just have puffiness but very minimal excess skin, because I can do that procedure and leave no scar on the outside. That technique is called transconjunctival lower lid blepharoplasty. Some people are good candidates for that as well. So typically the incision is either inside the eyelid or outside. All right. Is this covered by insurance? So lower eyelids are never covered by insurance, always cosmetic. Some cases, upper eyelids can be. Our practice here does not participate with insurance, and we don't submit codes or billing to insurance. So if you decide to have surgery here in our office, it would be considered not done through insurance. It would be considered all cosmetic. Some patients do get qualifications for it. You do have to go through some visual field testing and see an optometrist for that. So in rare cases, patients can get it covered. But again, in this office, we don't participate with insurance, so we don't submit to insurance. It's something that you would elect to do because of a cosmetic benefit. However, you will notice many patients will say their eyes seem more open, their vision feels like it's better, and they feel like things are a bit brighter. So there is some of that functional component to it, but it's considered potentially all cosmetic surgery here. All right, here's one. Can you explain your education as it relates to specifically to eyes and plastics? And also questions about insurance. We just addressed that, as well as cost. So cost varies depending on the surgery, right? As I mentioned, some surgeries are 45 minutes to an hour. Others are 2 to 2.5 hours or longer. So cost is varied based upon how extensive the work I need to do and how long patients are going to be under anesthesia. Training is important because we definitely recommend that you seek out a plastic surgeon who has good credentials and training. Part of our background as plastic surgeons is being well-versed in surgery all over the face, eyelids, nose, facial procedures. My fellowship was done in New York City, focusing on facial aesthetic surgery. So as plastic surgeons, sometimes further into our careers, we sort of specialize in a kind of a smaller field of cosmetic surgery. Mine is still relatively broad, but certainly all plastic surgeons who are performing cosmetic surgery on a regular basis are very well qualified to treat a cosmetic surgery or do cosmetic surgery on the upper and lower eyelid areas. Do you use dissolvable stitches? Occasionally on the inside, as I mentioned, when I use the inside of the eyelid approach, those sutures are dissolvable or absorbable. Generally speaking, for the upper lower eyelid areas, for the skin closure, it's a suture that we like to remove in about a week, mostly because it's very non-inflammatory, which means you tend to heal better and get a better scar with that suture. So most patients end up having at least 1 or 2 of their sutures that need to be removed. But in rare cases, you can do the procedure with all absorbable sutures. But most of the time, you come back about a week after your surgery, back to the office to have the sutures removed. Here's a question. Do you have experience working with Asian eyelids? So the answer to that question is yes. Part of my experience in New York was operating on patients from all different ethnicities, and especially Asian patients. Their anatomy is a little different than the typical Western or Caucasian eyelid. And sometimes their goals are similar, sometimes the goals are different. So it's really important that you have knowledge of the anatomy as well as listen to patients about what they want to accomplish with surgery. So the answer to that question is yes. In my training and in my practice, I've had a number of patients from different ethnicities with have different considerations for the crease, the scar, where is it located, and how do you address those things? Okay. Is there much risk of nerve damage? Very, very minimal risk of nerve damage. That being said, patients will say their eyelids can feel a little numb on the top and the bottom right after surgery. That's a normal, typical thing that we experience for all of our patients, whether it's face surgery or breast surgery. The numbness tends to get better fairly quickly with eyelid surgery. And after about 4 to 6 months, most patients can't even tell that there's any residual numbness. In terms of nerve damage to any other structures which would allow your eye to open and close and affect that, extremely low risk of that, just based upon where we're operating and where the anatomy is for that. Okay. I will be traveling from the other side of the state. May I travel home the same day by car? Yes, you can. So typically we do these surgeries oftentimes in the morning or in the afternoon, depending on how my day's flowing. But a 2-hour drive is pretty reasonable to expect to go home. Obviously, you can't drive, so you have to make sure that you have a driver with you. And actually, maybe, Brooke, you can talk about that because you live a little ways away, not terribly far, about what it's like to kind of get through the PACU, the recovery, and then home and that experience.
Yeah, so I live about an hour away from the surgery center. So my husband was scheduled to drive me here and then back home, but we were probably operating, you told me an hour, but it was about 45 minutes, and then it was pretty much wake up and you're good to go. So it was amazing that I could recover and like at home, and then I just had it done, and then all of a sudden I'm at home, like, you know, in quiet time, and didn't have to worry about anybody seeing me like right away.
Yeah. So yeah, for sure. We have patients that come here to our office from 2 hours north, 2 hours east. So it's very reasonable to go home after the surgery same day. Many patients are able to drive themselves back for their 1 week follow-up. I think you did that as well, correct?
I did,
yeah. So, but yeah, day of surgery, you know, you're not going to do driving afterwards, but certainly it's okay, you know, as an outpatient to go back home a few hours away. Recovery time for both upper and lower. So again, we kind of talked a little bit about that, but expect, you know, a week of kind of bruising. I think having that photo montage of Brooke's recovery was really important. I'm really thankful that she would share that with everybody. And, you know, sometimes they're a little scary looking, even though you probably didn't feel bad. It's how you look, right?
No, I didn't. No pain.
Yeah.
It was just, I looked scary, Larry.
You look a little scary. So I tell patients typically plan on a week of limited social stuff, unless you don't care if people know. Once the sutures are out, you start to have very minimal bruising that you can cover. So I would say to be safe, 12 days would be very, very reasonable, where you could be out in public. And I think you'd be pretty comfortable about how you look if you wanted to be more, you know, inconspicuous that you'd had anything done. If you decide to schedule the procedure, how far out do you generally book? So booking is based on a lot of factors, seasonality, things of that nature. You know, typically for my schedule, depending on the time of year, it can be anywhere from 6 weeks to 9 to 10 weeks. But because some of these surgeries are relatively short, sometimes even though we're booked out longer, we can find little spots in my schedule to add them on surgery days, so that patients who are interested in getting into their having their surgery done sooner rather than later can we can accomplish that. So, you know, the best thing to do, the first step is to schedule a consultation where I will meet with you and we'll discuss all your goals, what you don't like about your eyelids and what can be fixed with surgery, and then receive the information on the cost of the surgery. And at that visit, you will have the opportunity to sit down with my scheduling team. They go over cost and they go over my calendar if you have a specific time that you're looking for. But generally speaking, I tell patients, if you have a specific time for surgery, come and see me about 7 to 9 weeks prior to that, and you're more likely to get that date. If you have hooded eyelids to begin with, what expectations should one have? Well, you know, it's just like anything in cosmetic surgery. Where you start often determines where I can get you for your endpoint. Hooded eyelids, though, are very common, and you should expect to see a pretty noticeable, significant improvement. Sometimes those patients have the best results because those results can be very noticeable and good. Oftentimes, though, there's a limit to how much skin you can take. We want to be responsible and not, have a low risk of complications. So when I discuss the goals of the surgery with patients in their consultation, that's when I tell them, here's what I think we're going to come out to in terms of a result. I also encourage patients to visit the website. There's quite a few photos of patients of all different eyelid shapes and skin levels that have had this procedure and similar procedures, upper and lower lids. So that way you can get a good sense of what patients tend to look like afterwards. All right. I had upper lids done in 2008, but I needed to have it again after 16 years. Is that typical? Yeah, I would say it's certainly not rare. I mean, if you think about how you look 16 years in the past, tissues do age, and sometimes 15 plus years after an eyelid surgery, you may find that there's a little bit more skin there than there was after. It's typically not as involved as the first time around, but it can be done very safely in the future again, especially the upper lids. Lowers are a little less common to do, but uppers certainly can, because sometimes your brows, when you had the eyelids done, weren't that heavy, and then 15 years later, now they're a little heavier, and they're contributing to that. So we would say that these results, obviously are not going to be the same 10 years down the road as they are 6 months. But generally speaking, eyelid surgery lasts quite a long time. And most patients should expect to get a minimum of about 10 plus years out of the procedure, but probably longer. Is sun exposure a risk during healing? There is definitely, we encourage you to avoid laying out in the sun. But if you're going to be doing this procedure in the summer based upon your work schedule, you can still have it done. We just encourage sunscreen on your face, a hat, sunglasses to protect the scars. When they're very, very early from surgery, you just wouldn't want to be actually like laying out and getting direct sun on your face. These days, not that many people do, lay out with baby oil or any of the things that they used to do back, when we were kids. But overall, you just want to be cautious. It doesn't mean you can't do the surgery in the summer. You just want to make sure you're protecting your scars early on. And we remind patients about that when they come back for their follow-up. What would make someone not a good candidate? Well, a couple things. Number one, if you don't have enough skin to remove, you don't want to have surgery. If you have any underlying conditions with your eye or eyelids that make you much more prone to irritation, like thyroid eye disease that's not well controlled, or significant problems with tearing or tear production, or the tear ducts that drain the tears, or significant or chronic condition called dry eye, or other autoimmune conditions which can make your eyes very dry. Those are conditions where we'd be very cautious. Sometimes I won't do both upper and lowers together in those patients. I will do only one and let you heal, and then do another one potentially down the road. Other problems or conditions, specifically if you're on medication that you can't get off of that thins your blood, like if you've had multiple strokes or heart attacks and your cardiologist is like, you're on this blood thinner for life, you can't get off it, it's too risky. Certainly we can't do surgery on patients who have those medications for bleeding purposes. So it's pretty rare that somebody's not a candidate at all, but we always do a thorough medical history so that we know as surgeons, whether or not, what precautions we need to take with you ahead of time. What would having Sjogren's then be a potential issue for the surgery? So yeah, that's a good question. Sjogren's syndrome is a condition where some people have an autoimmune problem and it attacks the glands of saliva and tear production. It doesn't mean flat out no, but we have to have special considerations, as I mentioned. Number one, if it's well controlled and you're on sometimes medication, then it's reasonable to do it. I would probably space out doing both uppers and lowers together in those patients in order to not stress the eye as much, and then get started on drops like ocular lubricant drops ahead of time. If patients are having a very hard time with their Sjogren's disease, meaning that they're really having a hard time keep getting to a good baseline of tear production, then that could be a scenario where, yes, we would say it's not the right time. You need to, make sure that you're getting some good medication to feel better about the tear production. Good. Let's see if we have any other ones here. So a couple friendly reminders that you're going to get a text at the end of the event If you're interested in scheduling a consultation, as a benefit to attending the webinar today, you will be able to schedule a cosmetic consultation with me at 50% off of the normal consultation fee. They just need to reply back EYES, EYES, to the text to be able to get the consultation scheduled. So we'll give it a couple minutes here to see if any other questions filter in. Great questions, by the way. A lot of those are very thoughtful, good questions. We try and cover everything in the webinar, but certainly things come up specifically to specific patients that we want to address with that. So I'll kind of turn to Brooke and say, is any kind of parting messages or anything you'd like to say as we kind of wrap things up?
Yeah, I would just say, a lot of the ladies that follow me on my page, their question was how soon they could return to work. I got a lot of that question. And as long as, you feel good and you feel comfortable wearing the glasses and you're not worried about maybe seeing the bruises. I think they were kind of very like, how soon can I sit at a desk and see people without with minimal bruising? And so I would say, you guys saw my before and afters, and by the dates. And that's why I took those, so that people could really get a good idea of like, okay, could they return to work after 10 days? Like if they had it done on a Friday and then that weekend and then they had the week off. So, I would say like you could take a week off, or you could go back. There would be no reason why I couldn't have gone back to work that following Monday. It's just you would be having some bruising. So
yeah, I mean, again, it's more how you look versus how you feel. If your job isn't super strenuous, you're not bending and lifting, it's a question of, do you want your coworkers to know or not?
Yeah.
And that's really up to you. But really, there's not a ton of restrictions afterwards because it really is very mild. One question that kind of reminds me, kind of segues into exercise and working out, right? Because so many patients want to know about that. Typically light cardio would be at about 2 weeks. Really important, though, to keep your head elevated, like up when you're sleeping at night for the first week or so. So things that would be definitely no-nos are like, downward positions, like yoga classes where your head's down, that you want to be out closer to 3 to 4 weeks. And then any really heavy like weightlifting or resistance training is usually about 4 to 6 weeks. But certainly up, walking and moving is very, very quick. Feeling good, back to normal is really within a matter of days. Again, just kind of waiting for that bruising and that swelling to go away. But, again, we try and minimize that for patients, but it's just, you have to build in a little bit of that buffer for the recovery, but then you won't be disappointed in terms of the timing. Oh, we got another question that popped in. Can you perform a lower entropion repair lid rotation at the same time as an upper bleph? That depends. Very unique and anatomical findings. That'd be something that you'd have to come in for an examination for me to see. But oftentimes the answer is yes, depending on how severe that entropion or ectropion is. All right. Well, I'd like to thank all of you. Hopefully this was a nice way, an informal, easy way to learn more about all the options that we have here. Also want to, again, thank Brooke for being so forthcoming and open with her journey here. Seeing her photos from that time of surgery, day one, and all that is really helpful because, oftentimes patients are just freaked out about what they're going to look like and how am I going to look. And seeing her photos and how good she looked at literally a week to 2, I think is pretty indicative. I think that's where 90+% of patients will end up. So we're glad that you could join us and encourage you to reach out, schedule your consultation as attendee. You'll again receive a 50% off. And we look forward to connecting with you in the future.